Okay. Hi.
Hi, Dr. Barker.
Hi. For those who are tuning in or who may be watching this, this is Holding Space with Dr. Christopher Barker, and I have a guest. I'll let you introduce yourself.
Hi, my name is Josh, and I'm an accredited cognitive behavioral therapist from the UK. I'm also trained in EMDR and acceptance and commitment therapy.
Great. Yes, I've had some training in acceptance and commitment therapy also, and also EMDR. And again, I was saying before to you, I think we have some differences in how things are done in our two countries, and it would be nice to be able to sort of take a look at some of those also as
Yeah,
we process some of this.
yeah, definitely.
But so anxiety, I see a lot of it. I have a lot of it at times. It depends on the week. And I know we had said something about the differences between anxiety and OCD. If you have any thoughts on that in particular, please.
Yeah, and very relatable, Dr. Parker, because I can experience lots of anxiety as well, and my brain can be very obsessive, and that's why OCD has always been such a huge passion of mine, because I can really relate to it, and I can see clients who come with sort of generalized anxiety, but I see a lot of clients who come with OCD as well, and I think often OCD gets labeled as an anxiety disorder, but the way I see it is it's often shows up in lots of difficult emotions, not just anxiety. And I think we often think anxiety is the primary emotion in OCD, but for many of the clients that I see, it's not. It's part of it, but a lot of clients will present with chronic shame, guilt, embarrassment, sometimes disgust, which really contributes to sort of the OCD cycle.
Yeah, I agree. I tend to see anxiety as existing on a continuum. There's the one end where it's just kind of like stage fright, and there's the other end of the spectrum where it does run into more severe paralysis, really,
Yeah.
essentially. And OCD often can be paralysis. There's also obsessive compulsive traits that don't necessarily meet the criteria of disorder.
Yeah.
I personally like to straighten the frames in my office periodically. I will look up and I'll see, oh, that one's crooked. And I don't stop my session in order to do it, but you can bet as soon as the person's out the door, I will. Um, is it a disorder? No, I don't think so, because it doesn't cripple my living. And I think
Yeah.
that's the primary criteria for me, is like, when is this a disorder? It's a disorder if it gets in the way of living.
Yeah, definitely. And I often speak about that with clients, Dr. Barker, that I see that when I'm working with clients on OCD, the part that we're targeting is the D part, the disorder, because for many people, they will be very obsessive and compulsive, because for a lot of people, it can be part of their personality and sort of the way they've done things for many years. But when it starts to really interrupt their life in many ways, that's when we really want to sort of seek treatment for this.
Right. Um, Intrusive thoughts. I know we've talked about intrusive thoughts can happen. And again, that doesn't have to necessarily become disorder. But I have a number of people that I work with that they will have a sort of script for how they handle conflict or how they handle most life situations. And anxiety is just sort of always part of their background noise.
Hmm.
But if something trips that script so that they start experiencing the feelings of, I have to do something in response to this. Usually it's OCD can be a way of controlling anxiety that becomes its own anxiety.
Yeah.
So, if you're already an anxious person and everything has to be just so, then that's one way of controlling that anxiety, but you're substituting a different anxiety, which is the everything has to be just so.
Yeah.
And if it isn't, then that creates a problem.
I actually think OCD preys on our anxieties in some ways, because what OCD often does, and I can relate to this in a lot of the clients I say this, is that OCD often throws up a solution to someone's core fears. Hey, come with me and do this compulsion and we'll make sure everything's okay. But that actually becomes the problem. And we carry on checking. We do more and more compulsions, and it's never enough to satisfy OCD.
Yeah, that's true. I had one person that I used to see who had an intrusive thought about perhaps in her haste to drive to the office, or actually she did this in a variety of places, but it would happen even when she was going to drive to see me, that somehow she had done something careless in traffic and made a car run off the road. And the thought would occur to her, and there was nothing to do for it except to go back and check. And
Yeah.
sometimes she would have to go back and check and then go back and check again because what if that wasn't the right spot that I went to? It essentially wound up going back home and then starting the whole voyage all over again.
Yeah.
That got in the way, of course, of attending sessions on time and getting to work, just about everything. So sometimes that driving compulsion to check is um, is one of the things that we see most commonly, I think.
Yeah, because I think often at the core of OCD is it's a doubting disorder. So it's like OCD throws up this doubt around uncertainty, and then we get pulled into needing to verify whether it's true or not. But it's the compulsions that actually create more doubt and uncertainty. So it's a never-ending cycle, and that's why it can be so debilitating for so many people.
Yes, that's true. Um, I mean, a lot of people who feel like they're very organized, organization is fine, but it's it's more than just that. It's a tendency to feel that this organization has to be followed, and
Yeah,
that can get in the way of living. I mean, anxiety serves its purpose. It does things evolutionarily, it keeps us from doing things like picking up rattlesnakes and throwing rocks at policemen, but it also does things like keeps us from leaving the house if it becomes bad enough.
absolutely. And I think one way to differentiate anxiety and OCD as well is sometimes with OCD is the thoughts will, a lot of the clients will say, I know, Josh, it's illogical, it's irrational, the thought I'm having, but I still have to do this compulsion. Even if on paper it doesn't seem connected in any way, there's this urge that I just have to do it.
Yeah, and some intrusive thoughts become a thing that it's like I have to defend against this thought. I can't even have the thought. And
Yeah.
I think that's where ACT comes in handy. If you want to tell us a little bit about how you use ACT with anxiety,
Yeah.
I went to a training workshop on that and I found it to be so valuable and been using
Yeah.
it a lot recently.
Yeah. ACT is one of my favorite approaches and especially for OCD, but sort of how I often sort of worked with ACT and OCD is because what we know is OCD, it feels like our brain is constantly shouting at us that this thought is dangerous or that we need to fix it. So then naturally, we often try to push the thought away or do something to feel safe, like check in or repeating an action. But what we find is the problem is the more we try to fight these thoughts, the stronger they seem and the stronger they come back. So it can be quite a different approach because it's less about trying to get rid of intrusive thoughts or uncomfortable feelings. It's more so helping individuals to make space for them without letting them control your choices. So when I work with individuals with OCD using ACT, we look at things like being able to notice intrusive thoughts without getting stuck in them. For example, saying things like I'm noticing that I'm having the thought that, and then we insert the intrusive thought. So we're seeing them as intrusive thoughts rather than sort of thoughts that define who we are. We can work on allowing uncomfortable feelings to come and go naturally. So instead of battling with our feelings, learning to make space and allow feelings to be there. And I think a really big part of ACT as well is really helping individuals to get clear on what matters to them because OCD really takes away our values in life. It takes us away from what we enjoy. It can take us away from showing up in our relationships at work. Acceptance and commitment therapy can really help us realign with our values and who we are at the core because we're so much bigger than our OCD. And it helps people to take small, meaningful steps towards the things that they care about in life. So it can be very action orientated and so useful for so many people.
Yeah, I agree. And I think the defusing is sometimes really difficult because people do tend to see themselves as becoming their disorder. It's
Yeah.
I'm an anxious person. No, you have some anxiety about what? And I'm having a thought of this. I have somebody else that I'm seeing who has a tendency to fight with her boyfriend when she's feeling upset or anxious. And so, and one of the things we talked about is saying, I'm feeling like I'm anxious. I'm feeling like I want to fight with you now for no particular reason. I'm just having that. And that kind of takes all of the steam out of it because it's like she recognizes it as an irrational action. And that sort of prevents her from actually going down that road too
Yeah.
far.
Because I think when we start to notice and separate a little from our own thoughts and feelings, it gives us a lot more choice in then how we act. And we can then move towards our values and not have to obey or listen to these thoughts and feelings constantly.
Yes. I noticed that we were going to discuss also how EMDR can be used for something other than PTSD. And I've done a few episodes on how there's different types of trauma and trauma in and of itself. I did a couple on complex trauma and how
Mm,
not getting feedback early in life from parents or caregivers doesn't give us a clear expectation of how to live life. And we
yeah.
don't get proper role modeling. And so therefore that creates sort of a complex trauma that wouldn't be called a trauma if it's not like, you witnessed something really horrible. But at the same time, the trauma is what you do. It's acting out the anxiety, the uncertainty, the fear of that things are not going to work out.
And that anxiety very much becomes like our safety blanket when we grow up in households like this. And no wonder then as adults we cling on to our anxiety because it's what probably kept us safe growing up.
Yes. Yeah, and it becomes a role too. I mean, it's sort of like then once you start becoming the anxious person, then that's sort of like what is expected of you. You
Yeah.
are going to act out on your anxiety, and some people are going to get ignored for that. They're certainly not going to get the right kind of feedback for that. It gets
Yeah.
reinforced.
Absolutely. And I think, yeah, EMDR can be so great for targeting these types of memories that might be attached to feelings that are still really impacting us in the present day.
Yeah. Um, what kinds of other issues do you do EMDR with,
Yeah, I
other
do
than
EMDR with a wide range of issues. So one that I see a lot in my clinic is low self-esteem. So a lot of clients I see will be struggling with how they feel about themselves, often feeling like inadequate, feeling unworthy. They often present as perfectionists, so a lot of them are high functioning, doing really well in their careers, but underneath that, they just feel very unhappy and feel like they're failing still in life. And often when we explore this, we can see that often it stems from really difficult memories from growing up that have really impacted these sort of negative core beliefs that they've developed. So we can use EMDR to go back and work on these types of memories to process them, which can be so helpful.
yes, yes. I've found it to be useful for everything from depression, anxiety,
Yeah.
real trauma, but small T traumas, as they say, are also it's really useful. And anything that keeps you from living the most productive life is technically a trauma.
I found it really powerful as well with clients who present with social anxiety disorder as well, because for many people with social anxiety, a lot of the feelings they hold today will stem back to memories at school or at home where they felt embarrassed and felt super anxious, and that still really holds them back today when they're at work and they're given a presentation.
Yes, I've seen that too. I remember in our training, we had one person who expressed a phobia of bridges, and it turns out it was related to a very not totally related to bridges incident, but something that happened on a bridge. And
Mm,
that became a sort of a phobic reaction to bridges to the extent that he would go miles out of his way to avoid a bridge because
yeah.
he wasn't really sure why, but he just knew that bridges were terrible for him.
Yeah, and I don't know about you, Dr. Barker, but I sometimes get clients who have come to me and have had lots of therapy in the past, done lots of exposure therapy, but they just still feel very, very anxious. And that's often when we start to unpack actually what might be connected to this feeling. And often there is memories there that we need to process so that they can actually sort of be able to confront their fears.
Yeah. How do you use exposure therapy?
Yeah, so with my acceptance and commitment therapy hat on, I use it in a very values driven way. So rather than just making like a fear hierarchy, I tend to look at actually like what's this anxiety stopping you from being able to do, and then exploring the values behind why they would like to do it. So rather than like I'm just so scared of going to the mall and I don't want to go shopping, it's more so actually looking at like why does that matter to you first, really exploring like what the anxiety is taken from them, and then making a sort of a list of values driven exposure tasks and looking at actually like what they want to be able to reconnect with rather than just placing someone in a situation because it makes them feel anxious. Actually really like connecting that to what they care about in life, I find really helps with exposure.
Yeah, that's great. Definitely. I think I should incorporate more of that also because really exposure therapy. Okay, so you're exposed to something that creates anxiety, and yes, that may minimize your fear of that, but what does it really mean to you? And that
Yeah.
meaning is really important.
Yeah, because I think at the heart of ACT is workability, which is basically looking at like what's working for you in your life and what's not. Because if it's working for you, we don't necessarily need to work on it in therapy just because on paper it might sound like an issue. If that's creating the life that you want to lead and creating meaning and purpose, then it's a workable action. It's when it's unworkable, that's when we want to sort of address it.
Yeah, no, that's good. CBT usually looks at like irrational thoughts and cognitive distortions. And, we can again sort of examine that as being something that is operational here, that we're having a cognitive distortion, we're thinking something irrational. But at
Yeah.
the same time, if we're not back in touch with why it really matters, it it's just a closed loop, so to speak.
Yeah, because I think in CBT we can use cognitive restructuring, which I've seen change people's lives. But I've also found that when people's way of thinking might be very repetitive and very long standing, whether it's like overthinking, rumination, I think sometimes actually working with the process rather than the content can be a lot more helpful, particularly in OCD, is actually helping people to change their relationship with their thoughts as opposed to trying to come up with alternative thoughts in itself.
Yeah, that's important. And I think that's also important for people to realize is that sometimes this is being reinforced for years. We may have someone who's coming in who's had a particular phobia, a particular obsessive compulsive, particular anxiety disorder for years, and
Yeah.
they've managed to structure their lives such that it keeps that alive. It's almost like they're feeding a caged animal. It is at the same time as the reason that they are here, but it's also something that they will sometimes fight very hard to hold on to because, well, it's all they know. So,
Yeah,
being able to take that apart, why? Why would I take that apart?
exactly that. And I often find that so much with anxiety is that anxiety is usually the reason that prompts people to get in touch with me. But then there's also a part of them that understandably is very scared to let go of that anxiety. So in one way there it's causing them lots of disruption in their life, but there's another part of them that's petrified of actually walking away from this anxiety because it's what they know. It's what's probably kept them safe in many situations growing up as well.
Yeah, I think if you strip it down to its core, for a lot of people, they're afraid that if they get rid of this particular obsessive compulsive pattern, that they're really just it's either death or they're just not sure what's going to happen, and so the fear
Yeah, it's
enables them to
terrifying,
hold
isn't
on
it?
to it.
If you've lived your whole life convinced that you have to do this stuff in order to stop bad things from happening or to stop being judged or ridiculed by others, it's so scary then suddenly to let go of that. And I think
Right.
that's a lot of the work I do with many clients, particularly around self-compassion as well, because I work with a lot of clients using compassion-focused therapy techniques. And again, a lot of that work is actually working with the barriers towards compassion because for people that haven't been shown compassion growing up, actually, when someone shows it to them, it can be very threatening. It can actually activate your threat system when someone's nice to you because it's not what you know. So again, a lot of that work is working with those barriers and blocks that show up.
Yeah. No, I'm glad you mentioned that because compassion really is hard for a lot of people to come up with. I run across this a lot when doing inner child work with people is they
Yeah,
can't really get in touch with that child or they have difficulty in showing compassion for their inner child and
yeah,
compassion for themselves for dealing with a symptom is also a part of that. You just
yeah,
find yourself unable to like really give yourself room and have space for that.
yeah.
I know I refer people to Brene Brown a lot,
Yeah, so do
and
I. I just recommended a book to send today to actually to a client.
yeah, and that's so important, but it seems so basic in so many ways, but it's so hard to do.
It's so hard to do, and often that is the work for a lot of the clients I work with because what I've even found with CBT clients were able to come up with balanced alternative thoughts, but because they were still saying them in a very harsh way and still saying them in a very critical tone, it still had a huge emotional impact on the way they felt.
Yes, that's true. To be able to go forward boldly and without judgment is, and to have compassion for yourself. Um,
Yeah.
And she has so many great stories and slogans too that it's things that people can get hold of and relate to. And that's also a big part of it is find something that's relatable to this person because not the same thing works for everybody, and we have to
No,
tailor the approach to the person.
exactly that. And is it Brené? She's got the book. Is it The Gift of Imperfection? It's a wonderful, wonderful book that I recommend to a lot of clients who come with low self-esteem and perfectionism, and they find it just so relatable.
Gift of imperfection. Remember that one, folks. That is important. Anything else that we need to work on or look at?
I
Closing
think,
statements?
yeah, I think in terms of just like some practical takeaways for listeners as well, just in terms if someone's listening to this today and they are feeling a little bit anxious and they don't know where to begin, I think a great place to start is through some grounding exercise. By just if you are feeling like physically anxious today, just actually start to use your body as a way to just bring yourself back to the here and now. So maybe doing some light stretching, doing some slow, gentle breathing. One I often do with clients is just where they breathe in for 4 and then exhale for 6. And we play around with the numbers because everyone's got different lung capacities. But essentially, what we're doing with slow and controlled breathing, really extending the out breath and really focusing on slowing down. So using the body is a great anchor, I find, if you're feeling anxious. So just even like just noticing 5 things that you can see around you, or just noticing some sounds that you can hear, and really just trying to bring your attention back to the here and now. I know it's not easy and it takes a lot of work, but it's a really good starting point.
Yeah, that really is important. And you're right. You can't really begin to do any kind of work until you're back in the present, until you're here. So
Yeah,
yeah, I do. I found that type of breathing technique resets your nervous system, and essentially it just like really can bring calm and brings you back to the moment. Box breathing,
yeah,
all the even like some core meditation techniques that people use, anything that works. And for
yeah.
different people, different things are going to work.
Yeah, box breathing's great. I love progressive muscle relaxation as well. That's one that I often use a lot because I have ADHD myself. So I often find that with grounding exercise, the more physical I can make them, it just really works well for my brain.
Yes, yes, that is true. I have actually in the past recorded for people some exercises involving progressive muscle relaxation and like guided imagery to sort of like get them in the mood
Yeah.
because they say I just can't do that in my own head. I need to hear somebody's voice doing it.
Yeah,
So
imagery is
sometimes I
amazing
will.
as well. Yeah, imagery can be so powerful.
It is. And I know we talked about why trying to just stop thinking doesn't work because this is what has worked. And your thoughts rebound and you go back to the same place over and over again. And just stop that is not going to be very effective for people.
Yeah, if the problem is overthinking, it's very hard to think your way out of overthinking. We need to change how we relate to that process, use the body, be able to train up our attention. So we need a completely different approach to probably what understanding people have done their whole life, which is in their heads.
Two things also that I use from dialectical behavior therapy, I'm certified in that also, is
Oh, amazing.
it's being able to alter your sensations, put your hands in cold water,
Yeah,
hold ice, anything that essentially will sort of like bring your body back to the present.
yeah,
Also, being able to focus on mindfulness is
yeah,
something that's really valuable. They taught us to do it with a raisin, and you really can spend 10 minutes on a raisin. And we recommend that if people spend the first 5 minutes of the morning, first bite of food that you take, totally
yeah,
focused on that, brings you back to the present, sort of has a
yeah,
ripple effect on
yeah.
decreasing anxiety overall.
Yeah, this is
So,
yeah, I love that
mindfulness.
idea. And it's something I actually try to do with my morning coffee or tea is actually I try to move my phone out of sight and just spend 5, 10 minutes just literally noticing what it's like to drink this hot drink and really trying to ground myself before the busyness of the day ahead.
Yeah, no, that's really important. Um, okay, as far as red flags go, when do we seek professional help?
Yeah, so I think particularly in relation to OCD, if you find that your intrusive thoughts are feeling very intense, if you're finding that they are showing up constantly, you're finding it hard to let go and they're causing sort of really difficult emotions like fear, guilt, shame, this is a sign. And I think with compulsions, if they're taking up a lot of time. So going back to your example earlier, Dr. Barker, about actually you can get on with your session and not have to go and rearrange stuff. If you're having to change what you're doing because of the compulsions and rearrange your life because of a compulsion, that's probably a time to seek some help. So if daily life being disrupted by this, you notice that your relationships are being affected by the way you're feeling, or if you're feeling really tired, exhausted, hopeless, it's definitely worth, reaching out for some support, because OCD can be so debilitating, but thankfully there's some really effective treatments out there that can be life-changing.
I think that's a really good point too, is that sometimes this is where the anxiety depression bridge occurs, is that it's just so exhausting to keep up with the anxiety that, it feels like the negative self-thoughts start happening. Oh, I'll never get free of this. I'm
Yeah,
absolutely, stuck in this, and life is no good. I'm no good. And then all that negative stuff starts flowing, dominoes
exactly.
falling. Well, thank you for being here. I appreciate it. And
Yeah,
I
pleasure.
mean, we call the show Holding Space because we try to hold space for every different type of issue that we talk about. And, I think anxiety and depression are good ones to hold space for.
Yeah, and thank you for having me, Dr. Barker.
Thank you. I've been wanting to talk to someone from other countries and other cultures to see how we all examine this. And we're all working on with similar tools here, and that's really
Definitely.
valuable.
Yeah, yeah, no, really enjoyed it.
Thank you. And, feel free to join us anytime.